Hi, I'm Robin Toller-Hickey. I'm the owner of Rebalance Pilates, and in today's video, we are going to continue to look at some stretches and a little bit of strengthening exercises that you can do post breast cancer surgery. These exercises build on the foundational exercises that we did in the previous video, so if you haven't checked that out, please take a look at that. It's a great way to start to massage and open up and prepare the tissue for the work that we're going to do. Now, I just want to say that some of these exercises, they're pretty general. So please make sure that you consult with your doctor, your physiotherapist, about the exercises that are appropriate for you and the type of surgery that you've had. And also, if you are working with a trainer, please make sure that you're working with someone who has been trained through Pink Ribbon program or someone who has a very clear understanding of breast cancer surgeries, reconstructions, mastectomies, so that they understand what it is you need in your sessions, okay? So we're gonna start. We're gonna start with an exercise called the scapula glides. So this is essentially just the shoulder blades moving around the rib cage and back toward the spine. So we're still working to manipulate and slowly start to strengthen the tissue around the affected arm. So what I'm going to do here, you can see my little shoulder blade. I'm going to gently reach my arms forward, and you can see the shoulder blade pulls forward in that protracted movement. And then if I imagine that this little bone is going to slide directly back to the wall, my shoulder blade slides back toward my spine. So I'm moving in this horizontal movement, not up and down. It's a different exercise, but I am looking for that horizontal, the shoulder blade gently pulling forward and the shoulder blade gently sliding back. Now, I also like to cue with the collarbone on this exercise because there is a bony connection between the shoulder blade and the collarbone. And the collarbone's a pretty easy bone to hold on to. So if I put my arm out and I gently place my hands around the collarbone, as I reach my fingers forward, the collarbone begins to round a little bit. It has a bit of a rounded feeling. Then if I image the collarbone just melting across the chest and opening, my shoulder blade is sliding back directly toward my spine. So I feel the shoulder blade pull around as I round the collarbone, and then I'm going to imagine that collarbone melting and opening across the chest, and the shoulder blade is sliding back toward the spine because of that connection. So it's a good way to keep the shoulder blade or the shoulder from kind of climbing up to your ear as you do that, which is something that I often see. I also like to do this exercise against the wall or on the mat for a couple of different reasons. One, it's very easy to rotate in this exercise, which isn't serving the muscles that I want to work. I'm really just working my back, and I'm not moving my shoulder blade to its fullest ability. It's also really easy with this exercise, especially as you draw the arm back to pop the ribs. So again, I'm not really working the muscles that I want to work. I'm working the muscles in my back, not the shoulder blade. So I like to have the feedback of the wall or the floor to help me out with that. It just gives me a bit of an idea of where my body is in space because I can feel that. From here, so we've started to work the tissue. We are going to go into our first foray of bringing the arm past 90 degrees. So a common exercise that is given is placing a piece of tape with the unaffected arm up on the wall, and that's sort of your goal line. And then you crawl the fingers on the affected arm up, and you see how far you can get to reach that goal. Now, I'm going past 90 degrees here, and if this is the first time that you're doing that, trying to reach that piece of tape right away, it can be pretty aggressive. So what I like to do instead is place my forearm on the wall. So I have this nice 90-degree position. And like having my back against the wall for the scapula glides, I'm getting a good amount of feedback through the bone and into the tissue. So I'm gently pressing into the wall, and I can kind of feel everything start to activate just by gently pressing into the wall. From here, I'm going to slide my arm up the wall, and I'm going to keep my elbow connected. So I'm only going as high as my elbow can stay connected, which, as you can see, is not very high past 90 degrees, and then coming back down. But you know what? This is the first time I'm going past 90 post-surgery. So I don't want to go to this crazy full range of movement that might compromise the tissue, the incision. I want to work slowly. I want to feel the muscles working. Because remember, we're not just looking to stretch that tightened scar tissue. We're also looking to start to strengthen the muscles that have been cut into and affected. So I like this. I'm getting feedback from my arm pressing into the wall. As I bring the arm down, I can feel the lat beginning to engage. I can feel the muscles under the armpit. And then when I'm ready to go past 90, I can start to lift the elbow up, but I'm still keeping my hand connected. And I'm only going as high again as I feel comfortable. And then I'm going to slide that hand back down and feel the activation of the tissue as I bring my arm back down. So I really like to have feedback. I like to know where my body is in space. And I feel that post-surgery, when we can kind of feel like we don't know what our body is doing, it's nice to have that feedback. So those are just a couple of exercises that you can do to start to build on the exercises that we did in the last video. And in our next one, we'll look at some exercises lying down on your back, which is going to give you the biggest amount of stretch. But until then, thank you so much, and we'll see you soon.